Now, more children are being hospitalized with COVID-19. The senior medical officer at the Mandeville Regional Hospital in Manchester is concerned about the trend and believes a government decision may have contributed to the problem. Krista Campbell explains.
Omicron versus Delta, the new variant more infectious but not as dangerous or deadly as the Delta strain. However, at Mandeville Regional Hospital in Manchester, Senior Medical Officer Dr. Everton McIntosh says children are more impacted by this fourth COVID wave than in previous outbreaks.
Over the last 2 weeks or so, we have had about 5 or 6 children confirmed with positive COVID. And we have had 1 death in a 1-year-old. Currently, we have 2 positive children on the ward on isolation. And this is a lot more than we experienced even during the Delta wave, when we had maybe 1 or 2 confirmed cases among our children.
And how does the resumption of face-to-face classes factor into this?
Especially for the younger children in daycare and kindergarten and so on. But they will always pick up respiratory illnesses. So you will always see from time to time you have these spikes in cold and flu among our children. And so we figure that that may have something to do with it, the fact that the children are returning to face-to-face schooling. And so there are, more numbers are coming in because of that.
Now, that's just his own speculation. However, Dr. McIntosh says the 60-bed pediatric ward is almost full with children who've been admitted because of sickle cell, asthma, and other respiratory illnesses. That leaves little room to house the increasing number of COVID-positive patients who, during previous outbreaks, were kept in an isolation area set up in the pediatric department. The COVID isolation ward has only 20 beds. The hospital has at least 33 confirmed COVID patients and another 5 suspected cases.
So we are looking at preparing another medical ward to be used as our overflow isolation area. Problem with that now is that we have to find somewhere to relocate those patients that were there. So we're currently looking at utilizing the outpatient department, which is being prepared as we speak to facilitate those patients. Not an ideal situation, but under the circumstances, it's the best that we can do.
And as COVID cases continue to overwhelm hospital resources, another message against the vaccine hesitancy.
On our isolation ward at the moment, for example, right now we have about 14 or so patients on that ward. Only 4 of them are vaccinated.
He says the vaccinated patients have milder symptoms than those who have not taken the vaccine. Krista Campbell, TVJ News.